So initially, it was called crisis intervention. And that started, originally the model came from Memphis, and that was due to an officer-involved shooting that occurred in Memphis. And unfortunately, in 2007, here in Topeka, we had an officer-involved shooting with a subject with a severe mental illness. We took a step back and we looked at that and we thought, there's got to be a better way to address these situations. And so we adopted Memphis's model and started the crisis intervention team.
It was also decided by officers who needed better training and resources to better assist those in our community living with mental illness.
Now we need to also take care of our homeless population. And so it just became natural that homeless outreach would also fall under our umbrella.
So Equity Access Shelter, EAS for short, is a single access point for anyone that needs any rent assistance in our community. The City of Topeka is the lead for our local COC. And so we work very closely with Behavioral Health Unit because they're doing the outreach, building those relationships and rapport with them. And then as they have needs, we partner together to get them connected to those resources and services.
The mental health facilities that we have, the services that are out there for, drug and alcohol. So there's a lot of things that not everybody knows about. And so this brought this collaboration together because resources that we know of and resources that the BHU knows of are able to come together, and we can provide those to everybody.
The collaboration helped us to have more efficient communication. It increased and built our partnerships and allowed us a secure way to better track the outreach piece and encampments and to be able to serve our homeless population.
Before, sometimes it would be a while, to find out about an individual. Now those individuals can just straight go into ClientTrack and get the updated information within minutes.
ClientTrack is the vessel that we use to communicate, to track everything, to track services, to prevent duplication.
We reduced the repetitiveness of the services that we were providing because everybody was on top of each other and not knowing what was already being provided for said person. And we were able to communicate between partners and ensuring that no one that we were assisting was being left out.
EAS uses ClientTrack as our coordinated entry system. So we're already utilizing that. It's a great system. The mobile readiness piece allows us to then track some of that data easier in the field. And it allows us to really see the exact pinpoints where a camp is and then if they're moving.
The most impactful benefit offered to ClientTrack is making every single person you connect with feel heard, appreciated, and cared for.
We're not the officers on the street arresting people, citing them, writing tickets. Fortunately, after 13 years, I get to be the nice guy, finally. Where we're going out and we're diverting people from jail. We're diverting people from the emergency room. If I can convince a victim that a low-level crime that costs them nothing is better served by getting this person treatment, we're going to be in a better position, probably be able to be better positioned to avoid frequent calls with that person again in the future. When we brought in homeless outreach, we were able to really take the time that we have and build relationships, individual relationships with each person. They genuinely get excited when me or Officer Razzo come down to the camps to talk to them. They enjoy our company, and we're just there as sounding boards, and whenever they're ready to move forward with drug treatment or housing, then we're there to hear them and help them through that process.
When I go outreach, I can take those out into the field and I can then make those referrals to those partnering agencies that we work with and say, I have a person that's struggling. This is their location. I give them like that geolocation of that individual. They can come out to them and they know exactly where they are at.
There was a little bit of hesitation on some of the agencies' part about we're adding law enforcement to the system. And so we did a lot of research. We looked at best practices. We talked to other COCs that are doing something similar. And it was really just adjusting some of our forms, our releases, adding clauses in there that were very specific. The police department, it's just the behavioral health unit that is allowed to access this information. They're not allowed to use it for any law enforcement purposes. It is specifically to help this individual. So adding those things, I think, gave the agencies a lot of relief as far as feeling safe and secure with the information, and with adding law enforcement.
Through the collaboration and continuous partnerships, and those concerns have been put to rest, and putting in place the safeguards and memorandums of understanding to ensure that we protect all information that's being involved and being taken from our clients that we are assisting.
You need to start with a specialty unit in your law enforcement program and give them the freedom to operate without having the duty to act. But we're not out there whenever a warrant comes through and I know the name, I'm not going to the camp to arrest them on that warrant.
It's building the trust, not only with with the agencies that we work with, but also those individuals that are in that crisis at that time.
It won't be seamless when you're trying to build these collaborations. There's going to be bumps along the way, but it can be done.
I would start with mobile access partnership. Basically, any social service agency in the city is in a partnership with local law enforcement as well to set up a mobile shower. The local mental health facility has intake forms on site. We operate, basically, we have a law enforcement officer there from my unit to answer questions about any legal issues they might have coming up. It's very easy to start. All you need is a shower and some lunches and a group of people that are there to do the right thing to help this population, and then make sure the population knows when and where you're going to be. If it wasn't for the mobile access partnership here in Topeka, we wouldn't be anywhere near where we are today.
If a community is not at a place where they can start with that, if it's too big of a step, start with what you have, because you already have things in place. For instance, our ClientTrack system, we have been able to customize that, and that even has made a big difference in our outreach and how we're better able to serve the homeless populations.
Have that compassion for them. They are human beings. They are no different than you and I. This could be any of us.
There's not one way to solve the issue. Tensions can and will build, but diminishing the involvement and undermining the productivity, just lead with open minds and lead with those open hearts as well.